Hello, my name is Disha, and this is Priscilla, and we are members of the professional organization Alpha Zeta Omega at the University of Connecticut. Today we'll be presenting on health disparities as a result of the African and Caribbean diaspora. Diaspora and health are known to be linked to hypertension and high blood pressure, asthma, heart disease, diabetes, mental illness, cancer, and maternal health, which we'll be going over in this presentation. Additionally, we'll be discussing factors, facts, prevention, resources for each disease, and more importantly, the environmental factors as a result of the diaspora and relevant resources, which can be accessed by individuals seeking care. We'll begin with environmental factors as a result of the diaspora. In terms of the relationship between diaspora and genetics, genetic factors are usually not drivers, except in the case of sickle cell disease. It's important to consider that high disease rates and poorer health correlates to decreased economic positions, decreased health access, and increased discrimination. Additionally, genetic predisposition can be driven by economic factors and disparities, such as high lipid levels and kidney disease. There have been links to ethnic variations, but disparities and inequality have kept the research very limited, especially in African, African American, and Caribbean populations. People of color are more likely to suffer the health effects and high stress due to discrimination like hypertension, high blood pressure, depression, sleep deprivation, which can lead to shortened life. Implications of this include higher risk of lifelong diseases and higher risk of shortened life. There's also risk of weathering, which is the body's erosion by constant stress, in this case, societal stress of structural racism. For example, a person may be hypertensive from weathering, but good access to healthcare can help mitigate it. There are also resources for those seeking care in this scenario. For example, the World Trust Resource Center can provide access to papers on health, restorative practices, and social justice. Family Support Group gives access to people you can talk to about struggles that the family or you have faced, including discrimination. Additional barriers that the population would likely encounter include cultural barriers, where traditional healing methods are not commonly understood by most healthcare providers, which can impact their ability to receive adequate healthcare if they have varying beliefs. Language barriers can make communication with the patient more difficult, but can be overcome in most cases with trained translators. There's also stigma regarding illness and mental health, which can prove to be especially detrimental for those suffering from mental disorders. There's much variability in trust of the healthcare system. Black Americans and Latinx report that they believe they would have received better care if they were a different race. There have been reports that they were spoken to rudely, talked down to, or even ignored. There have also been reports that they feel that their doctors do not understand their background or values. Additionally, in the past, there has been a history of unethical practices in treating people of color. Based on these findings and reputations, people of color are more reluctant to seek medical attention, which can be serious in dire situations. Due to this obvious lack of diversity in healthcare professions, Black and Latinx Americans are generally more satisfied with their care and feel that they received higher quality care when treated by someone from their own ethnic or racial background. As shown on the left, the top picture illustrates the results for diversity health versus the bottom picture, which shows the results for healthcare from a search engine. This shows that people generally associate healthcare with the bottom picture, which is evidently less diverse.
Other factors include access to fresh food. Access is often associated with a lower risk for obesity and other diet-related lifelong conditions. Healthy food retail also creates jobs. Some of these resources that we have listed below include Hartford Mobile Market and Connecticut Fresh Match. Grocery stores around lower income areas are often closed. Therefore, it leaves people to drive or walk further to afford fresh groceries. Imagine the last rich town you or your family drove by. Count how many grocery stores are there. Way more than needed, right? People live more than 1 mile from a supermarket in urban or suburban areas, and more than 10 miles from a supermarket in rural areas. Other factors include the lack of health insurances and resources. Connecticut has one of the highest percentages of insured residents, but insurance coverage is unequal across socioeconomic and ethnic groups. However, there are resources provided. For example, Hispanic Federation is based in New York City, but it has an office in Hartford, Connecticut. It is a nonprofit organization used to provide assistance to get access to Affordable Care Act. Now they have other programs for Hispanic populations if there is a need for accessible health care. The Hispanic Health Council is dedicated to provide resources and education to Hispanic and other populations that have special needs in Connecticut. The Access Health Connecticut is a Connecticut health insurance exchange. If people don't have insurance through their employer or are self-employed or uninsured, they can go to this site to obtain insurance. The Office of Healthcare Advocate is for people who have problem with their insurances or medical bills. For instance, if something is not covered or there is a surprise medical bill, they will be the patient's advocate against the insurance company. More information on these resources will be provided at the end of the slides. Including our hazardous living environments, contaminated water, poor sanitation, indoor smoke, inadequate food supply, unsafe use of chemicals, and waste disposal are also factors that can increase the risk of diseases. A healthier environment and a safer living environment would also create a healthier population. While these are the most common causes of developing diseases and one of the most varied factors across the different ethnic groups. Resources include the National Response Center for emergencies and other sudden threats to public health, such as oil or chemical spills, radiation emergencies, and biological discharges. This is the resources that you can contact for those instances. The Hartford Housing is a link to resources and contacts for Section 8, low-income public housing, and housing programs. Next, we will discuss the diseases linked to diaspora. So, to talk briefly about some of the diseases going forward, high blood pressure is an increase in pressure of blood against the artery walls. It occurs to almost everyone towards the later stages of life. Asthma is also very popular as well, the swelling of airways that can be triggered by allergens or irritating particles. Heart diseases, on the other hand, kills 647,000 Americans a year, and it costs the United States healthcare system $219 billion a year. Lastly, diabetes. Racial and ethnic minorities tend to have higher prevalence rates, worse diabetes control, and higher rates of complications.
As mentioned previously, high blood pressure is associated with an increase in pressure of blood against the artery walls. Almost everyone experiences this towards their later stages of life. Controlling blood pressure is of the utmost importance to improve nationwide health. It is not known to be transmitted person to person, and there are no real presentations of symptoms, but you must remain aware of your situation and strive to prevent the development of this condition. It may lead to severe heart conditions and complications, so again, you must try to keep a healthy blood pressure. Factors that can impact this include obesity, lack of exercise, high dietary salt and fat, and low potassium. If left untreated or undiagnosed, high blood pressure can lead to heart failure, heart attack, stroke, and kidney problems. To prevent the onset of this disease, people should look towards healthcare and see their doctor every year for checkups and ensure that they are staying adherent to their medications. They should also try to eat healthier foods, such as fruits, vegetables, and low salt and low fat foods. One should also try to exercise at least 30 minutes a day and try to elevate their heart rate. There's also ways to incorporate lifestyle changes to induce less stress and manage weight better. Things like quitting smoking and vaping can also help to decrease high blood pressure. And reduction of alcohol use can also benefit one's ability to keep a healthy blood pressure. In order to manage blood pressure, people can look through various resources. We've included the American Heart Association, which is a support network in a forum or site form where people with a variety of conditions can find support amongst others who have the same conditions. This includes a network for those with high blood pressure. Additionally, Aetna provides a health guide on how to control blood pressure. Asthma is a condition that causes swelling of the airways and spasms in the bronchi of the lungs. Allergens or irritating particles entering the lungs trigger asthma symptoms, so one must identify and avoid personal asthma triggers. Factors that can increase the risk of developing asthma or serve as potential triggers include family history, allergies, smoking, air pollution, obesity, and poor housing conditions, which are one of the greatest environmental causes of asthma. Symptoms include trouble breathing, wheezing, coughing, and tightness of the chest. There is no cure for asthma, but it can be managed. If asthma goes untreated, it can lead to death, hence you must stay up to date with vaccinations and take medications as directed for this condition. Again, it's very important for individuals who have asthma to identify what specifically triggers their symptoms so that they can identify what they can avoid to ensure that they don't induce. I'm just going to restart this. Asthma causes swelling of the airways and spasms in the bronchi of the lungs. Allergens or irritating particles entering the lungs trigger asthma symptoms, so one must identify and avoid personal asthma triggers. Factors that increase the risk of developing asthma or serve as potential triggers include family history, allergies, smoking, air pollution, obesity, and poor housing conditions, which is one of the greatest environmental risks of asthma. Symptoms include trouble breathing, wheezing, coughing, and tightness of the chest. There is no cure for asthma, but it can be managed. If asthma goes untreated, it can lead to death, hence you must stay up to date with vaccinations and take medications as directed for this condition. Again, it's very important for individuals who have asthma to identify what specifically triggers their symptoms in order to properly manage the condition. In 2014, Black Americans were 3 times more likely to die from asthma-related causes than the white population. About 13.4% of Black American children have asthma compared to about 7.4% of white children with asthma. This shows that Black Americans were affected more by this condition than the general white child in America. For resources that people can turn to for the condition of asthma, Putting on Airs is a program available all around Connecticut that provides at-home asthma assessments, education, and management. All staff members receive formal training from the Department of Public Health. The program includes 1 at-home visit and 3 more sessions over the phone. At the home visit, the asthma educator will collect a history of the patient's asthma, walk through the home to look for environmental triggers, and come up with a mutually agreed upon plan to avoid these triggers and manage the patient's asthma better. The 3 telephone sessions will serve as a follow-up, with both the patient and the educator discussing what the patient is doing well and how the patient could improve. The Asthma and Allergy Foundation of America has many resources for patients, parents, and caregivers. The most important resource to check out is the Asthma Action Plan. This is a form to bring to and fill out with your doctor. Once filled out, it will provide the patient and caregivers with what to do when symptoms get worse and what to do in the case of an emergency. Heart disease is a condition that involves diseased blood vessels, structural issues of the vessels, and blood clots. Heart disease can lead to irregular heartbeat, cardiac arrest, heart disease, heart failure, stroke, and heart attack. Factors that could increase the risk include obesity, physical inactivity, diabetes, high cholesterol, high blood pressure, stress, depression, anger, and smoking. To prevent the onset of a heart disease, healthy diet should be incorporated with fruits and vegetables. Physical activity that elevates the heart rate should also be attempted. Quitting smoking and cutting down on alcohol consumption can greatly improve the heart's condition. And regularly having visits to check blood pressure and cholesterol allows one to ensure a healthy heart. Black Americans were more than twice as likely to die from heart disease than other ethnic groups, such as Asians or Pacific Islanders, as established in a research study conducted in 1999 to 2017. Almost 44% of Black American men and women have a form of heart disease, showing that this population is greatly impacted by this disease. Resources for heart disease include the CDC Nutrition, Physical Activity, and Obesity website, which has information, strategies, and programs that can guide people on how to prevent heart disease through ways of having a healthy diet and incorporating physical activity into daily life. The Blood Pressure Monitor app allows you to track your vital signs and record them, giving you data you can look back at. Additionally, it allows you to monitor your health against your prescriptions you are taking. You can also share your data and history with your healthcare provider and family in order to help prevent the onset of this disease. The Heart's Foundation mission is to save lives by educating the public about heart disease, promoting early detection, and supporting the research taking place under the direction of world-renowned cardiologist Dr. P.K. Shah in the quest to find more effective ways to prevent and treat the #1 cause of death in the United States. Diabetes involves a hormone called insulin, which regulates the amount of sugar in the blood. It's needed for proper storage of energy after meals. Type 1 diabetes is a condition where the body doesn't produce its own insulin. On the other hand, type 2 diabetes is a condition where the body has resistance to insulin and therefore is unable to utilize the hormone. Unlike type 1, type 2 diabetes can usually be reversed and prevented. Prediabetes is a time period of high blood sugar before type 2 diabetes. About 24% of the population is at this stage. Acting on prediabetes can help prevent type 2 diabetes from developing. Those living with diabetes have to maintain tight control over the blood sugar levels to ensure they don't deplete their energy. Statistics show that racial and ethnic minorities tend to have higher prevalence rates, worse diabetes control, and higher rates of complications. In 2000, the Behavioral Risk Factor Surveillance System reported that 7.4% of Americans have diabetes, with a prevalence rate of 7% among non-Hispanic whites compared to 12.7% among Hispanics and 12.1% among Black Americans. Modifiable factors include obesity, where one can lose 5 to 7% of body weight, which reduces the risk of diabetes by half when overweight. Physical inactivity can also be improved when 150 minutes of activity per week is incorporated to help cardiovascular health. High blood pressure, if gone untreated, can lead to hypertension linked to diabetes. Abnormal cholesterol levels with low HDL and high LDL increases the risk of developing diabetes. Risk factors are never a guarantee that you will or will not get diabetes. Even those who are at high risk can prevent or delay diabetes. Becoming aware of how to read food labels is extremely important for managing your health and understanding what is in the food that you eat. Food labels can be used as a guide to eating a healthy diet for someone who is regularly eating 2,000 calories per day. Portioning food and using similar plates can help people to be more mindful about how much they are eating and being more mindful about how many calories they consume. For the prevention of diabetes, walking at least 30 minutes per day and losing weight can make a huge difference. Overall, the key for managing control over diabetes is taking small steps at a time towards a healthier goal. Non-modifiable factors include family history of diabetes, where one's genes can put them at a higher risk of developing diabetes. Race and ethnic background, where African Americans, Asian Americans, Latino, Hispanic Americans, Native Americans, or Pacific Islanders tend to have a greater likelihood of developing this disease. Age is also incorporated into calculating the risk because higher risk is prevalent after the age of 45. Resources for diabetes include the CDC The Road to Health Toolkit, which is written for African Americans and African ancestry and Hispanics and Latinos who are at risk for type 2 diabetes. But really, it can appeal to any audience. It will help people in these communities learn how to prevent or delay type 2 diabetes. The National Diabetes Education Program creates knowledge about treatments for disease that are among the most chronic, costly, and consequential for patients, their families, and the nation. This source has a variety of information on the topic of diabetes, which may help the patient better manage their condition.
Further on, mental illness has been a progressive topic in today's society. About 1 in 5 adults in America have mental illness, and it can begin at any age, but usually occurs earlier on. The diagnosis can be temporary or long-lasting, and a patient can have more than one mental illness at a time. Women have had more mental health issues than men, but there's also a misunderstanding of mental illness, which leads to worsening conditions and no treatment. Statistically, Black Americans are 20% more likely to develop mental illness than the general population. They are also 10% more likely to have a severe psychological distress. Factors that it could increase the risk of mental illness include genes and family history. If someone in your family has had mental illness, it is more likely that you're possible to develop one as well. Brain damage, lifelong chronic diseases, and traumatic experiences, such as physical or emotional experience, can also increase your potential to develop a mental illness. However, there is no absolute way to prevent the development of mental illness, but there are plenty of ways to improve the symptoms. So be sure to take good care of yourself, whether it's getting enough hours of sleep, exercise, engage in healthy eating habits, and having a strong support network. These things can help you take control of this illness. In addition, maintain a routine for medical visits. Find a healthcare professional that works for you. In addition, we have also provided resources, such as the National Alliance of Mental Illness. It provides support, education, and advocacy at the community level. They operate to support groups, to let people know that they're not alone, and that they are information and support when necessary. The National Health Service, the Mental Health, it provides important and unbiased, true information regarding different topics. The mental health highlights risk factors and what they can do to help you. In regards to maternal health, Black Americans are 3 to 4 times more likely to die during or after delivery than a white woman. The number of Black mothers not receiving prenatal care is just twice as much as Hispanic mothers and white mothers. Also, the number of low birth weight infants born to Black mothers is also twice as much as low birth weights born to white mothers. As stated in Connecticut, infant mortality rate in 2010 was nearly 3 times higher among Black Americans compared to white Americans. Statistically, from the public health magazines, Black African Americans have indicated that there's almost 12 deaths per 1,000 live births. For Hispanics, 7.5 deaths per live births. And for white Americans, 4 deaths per 1,000 live births. Factors for maternal health could include the maternal stress due to inequality and or inadequate access to healthcare services. Healthcare biases, lack of prenatal care starting within the first trimester, and low weight births. Healthcare has been designed to be biased, but now many professions are changing their curriculum to try and change this. In addition, maternal health preventions would be receiving prenatal care and going to prenatal visits regularly. This would mean every 4 to 6 weeks for the first 32 weeks, every 2 to 3 weeks for the 32nd and 37th week, along with every week from the 37th going forward until the delivery date. Monitoring your future baby's development and conduct routine testing. This would mean blood tests, imaging tests, and ultrasound examinations. For resources, Maternal and Infant Outreach Program is a free program with the goal of reducing infant mortality and low birth weight rates. It also has a goal to improve the overall health and well-being of women, children, and their families. Their services include making sure that all pregnant women are registered for prenatal care early in their pregnancy. Home visits are made to provide health and nutrition education and support. Following the health and development of the infant's first year of life, they provide emotional support when needed and linking women to health and community agencies as required. Pregnant women living in the greater Hartford area, as well as postpartum women with children under the age of 1 are eligible to be part of this program that served the local Hartford community for over 2 decades. In addition, WIC, Women, Infant, and Children provides a nutritional assessment and education referrals to healthcare and social services, breastfeeding education, and support and nutritious foods to supplement diets. In terms of nutrition assessment and education, WIC participants are offered individual nutrition and counseling and nutrition classes. They also give appropriate referrals to a variety of services such as SNAP, Head Start, medical and dental services, substance abuse programs, child care, and much more. With WIC, if you are qualified, you will receive vouchers for nutritious foods for diet supplementations. These vouchers can be used at your local grocery store or pharmacy. They include infant cereal, baby food, iron-fortified adult cereal, fresh fruits, vegetables, eggs, milk, cheese, peanut butter, dried and canned beans, canned fish, whole grains, and more. Lastly, we would like to discuss cancer. It is uncontrolled division of cells which leads to formation of tumors. These tumors can kill healthy cells and tissues. Factors that could lead to increased risk of cancer include poor diet, obesity, genetics, tobacco, and exposure to the sun. Statistically, compared to other racial groups, Black Americans have the higher death rate in the following cancers: breast, lung, prostate, and colon. However, there are ways to prevent the risk of cancer, such as do not use tobacco, healthy diets, eat a healthy diet when possible, drink alcohol in moderation, eat more fruits and vegetables, avoid sugar and high fats. Protect against the sun by staying in the shade, and also be sure to wear sunscreen. It's important to get vaccinated. Hepatitis B and HPV vaccines prevent cancer and are typically at no cost. Be sure to also get screened by your healthcare provider and check yourself for breast cancer or prostate cancer. Resources have been provided, such as the Connecticut Cancer Foundation with Hartford Hospital Social Work. They have a goal to work with oncology social workers partnering at Connecticut hospitals and cancer centers, and they are able to help patients and their families apply for financial assistances via the Connecticut Cancer Foundation. At Hartford Hospital, social workers are available to those with chronic illnesses such as cancer to help those in need without charge. Cancer patients are eligible for grants, but they must be a Connecticut resident and meet with the oncology social worker. The Cancer Net app is an app available in multiple languages and free in the App Store. This allows cancer patients to get more information on cancer, treatment, side effect management, cost of care, and up-to-date cancer information. Additionally, patients can track symptoms and appointments, and record questions for your doctors and record their answers as well. Patients can also log medications by taking photos of their bottles, log their dosage and frequency, and set a reminder of when to take their medications. While this was a lot of information that's been provided, we would like to ask, what are some things that can be done to prevent and decrease the risk of diseases? I'll give you a few more minutes to answer this question. Some of these answers include eating a balanced diet, sleeping, daily exercise, avoid risky activities, avoid smoking, and be sure to get vaccinated, along with getting your blood pressure, cholesterol, and sugar checked regularly. And be sure to go see a healthcare professional on a regular basis. As mentioned before, some of these are resources that have been discussed earlier in the slides. More information has been provided, including how to get in contact with them and their website link. In the future, there could be a live presentation for these slides. If you have any questions, please feel free to contact us at that time. And these are the citations that we have used to discuss the statistics and information that we have provided for you. Thank you.